Unit 7, page 3. How do drugs and alcohol affect fetal development? Do now. At what point are drugs and alcohol the most detrimental or harmful to the pregnancy? Take a moment and write that down. So you should remember that pregnancy lasts 9 months for humans. What we do is we divide that 9 months into 3 different pieces. We call it the first trimester, second trimester, and third trimester. Drugs and alcohol are actually most detrimental in that first trimester, the first 3 months. Remember, this is when a baby is growing and developing so much, so you don't want any of those developmental characteristics to be flawed because of drugs or alcohol. During pregnancy, you always want to avoid drugs and alcohol. They can be harmful at any stage in pregnancy, but they're most harmful during that first trimester. Remember that early development is critical in the life and success of a fetus. Now we'll talk about a few different drugs. Alcohol is a commonly used drug. It is the leading known cause of birth defects. It causes risks like miscarriage, which doubles when people drink alcohol. The average birth weight of babies is about 4 pounds for babies exposed to large amounts of alcohol. Remember, an average baby might be anywhere from 6 to 8 pounds. Also, alcohol can cause malformations, especially in the first 10 weeks. They can cause problems with the heart, limbs, and facial features in the baby, causing something called fetal alcohol syndrome. Tobacco is also quite harmful. It passes nicotine and cancer-causing agents to the fetus. It increases the risk of SIDS, which is sudden infant death syndrome. Only about 20% of women who smoke actually quit during pregnancy, unfortunately. It inhibits or slows down fetal growth. It depresses the woman's appetite and possibly deprives the fetus of nutrition. It reduces the ability of the lungs to absorb oxygen, which could possibly deprive oxygen to the fetus as well. Other drugs that might pose a risk are marijuana, which causes toxins to go into the fetus instead of oxygen, cocaine and methamphetamine, commonly called meth, causes withdrawal, sleeplessness, difficulty breathing or feeding. Defects of genitals, kidneys, and brain are possible with the early pregnancy use. Learning difficulties often prevail throughout childhood. With heroin, there's possible HIV transmission if they're using needles, also withdrawal, and increased infant death. PCP or LSD, which are hallucinogens, can cause brain damage or even birth defects.